Well, hello everybody out there. Ian Billinghurst here. Welcome to the final live question and answer session for the Raw Dog Food Summit. And once again, we want to thank our sponsors here today for making all of this possible. Have a look at their website. If you've got, well, I know that you need to have a good look at our sponsors' website because you're going to learn a lot from that. Now, today, what did we learn about? Well, it was quite a day, wasn't it? To dive into raw feeding, and I spoke about the evolution of our dog in relation to food, and I hope you now have a better idea of why it is we should be feeding raw food and what we should be feeding. Dr. Christian Vergara, he spoke about food behavior and gut bugs and the importance of the microbiome, particularly to brain health. What a brilliant exposition that was, and I hope and really hope you now understand the relationship, for example, between the brain and the gut. These two are intimately connected, and if you want well-behaved dogs, then feed them properly to feed a healthy microbiome. Ronnie Lejeune, she talked about exercise and dogs and the importance of not only feeding them right, but conditioning them, and spoke about antioxidants and the importance of the right fuel for your dog. Most particularly, it's important, of course, to feed fat and protein as the principal fuels for your dog. Paul Rabol, cancer in dogs, and the importance of food. And once again, you saw the danger of sugar to the health of dogs. To stop the cancer and to stop feeding the cancer. Most important, and the role of ketones and the role of a ketogenic diet. And the wonderful Rachel Fusero, sorry, Rachel, I was just mispronouncing your name. Speaking about the importance of variety and the importance of feeding food, we don't worry so much about nutrients. All the nutrients will arrive if we feed the right food. And so important to feed a wide variety. This I've also emphasised, of course, when I spoke about the evolution of the dog. And then Julie Ann Lee spoke of coprophagia and foods that have undergone autolysis, that is, degradation under the action of their own enzymes. Once again, providing an important source of nutrients for our dog, certainly that are included in processed pet food, contain nutrients that your dog wouldn't otherwise get. And illustrating the fact that when you feed processed dog food, you are feeding food that is a long way from being complete and balanced in terms of producing health and longevity for our dogs. A long way. All right, well, let's dive into it. Do we have any questions today? Because this is, of course, a live question and answer session. Well, I hope I pronounced this correctly, Marilu. Marilu, thank you so much for the valuable information. Well, that's what you're saying, and you're welcome, I'm sure. And helping our pets live happier, healthier, and longer lives. My goodness, that is what we want, isn't it? And the secret hidden agenda there, of course, is once we understand that for our pets, we begin to understand it for ourselves. Anyway, what specific bone can I ask from butcher for a senior, smaller dog to suck on as he has no teeth? Well, I think just if he has no teeth, then maybe just a lamb shank bone. He can certainly suck on that, have a wonderful time with it. Um, the lamb shank bones, they're full of meat, and we're not going to worry too much about our senior dogs having to eat the actual bone. You can get that from the calcium and other components. And you can also make a bath patty, of course. So just a lamb shank. That would be my thoughts for that question. Okay, next question. Is the chat the way we get specific questions answered? Well, I'll do my best, but sometimes very specific questions relate to a dog where I haven't had the entire history of the dog, so sometimes I can't answer extremely specific questions. But anyway, I'll do my best to try and steer you in the right direction, no matter what the question. Diane. Okay, are veggies which are blended the same nutritionally as those which are juiced when raw feeding? Okay, and this is a good question because you have to understand what goes on when you juice veggies as opposed possibly to blenderize. Now, if you're blenderized or blender does exactly the same job as a juicer, that is, breaks down every cell to release the juices and release the cell walls, then that's absolutely fine. Because the thing is, dogs cannot digest cellulose cell walls. And we have to do two things. We have to release the cellulose cell walls to be used as fiber by the gut microbiome, and we have to release the contents. So unless you're absolutely certain that your blender can reduce those vegetables to a completely pulverized, juicy, situation, or I can say mess, but it is a mess, isn't it, when you juice things? It creates a huge mess, but it's all contained in the bowl, of course. But the important thing is to break down every cell wall. The juicer does a superb job of that. Sometimes the blender doesn't do quite as good a job. So that's the important point there. What you can do too, though, is if you freeze the vegetables beforehand, because water expands, then that actually helps to break down the cell walls, and that may help with your blender. Just a thought. Next question. What are the best raw bones for Chihuahuas with sensitivities to chicken? Thank you. And I wonder, does your Chihuahua actually have a sensitivity to chicken? That's my first question, because if the sensitivity to chicken was done with some of those tests, skin tests and so on, there may not be an actual sensitivity to chicken, particularly to raw chicken. But if you know that is the case, then you might certainly look at, say, things like, I was thinking of turkey wingtips for your Chihuahua, unless the turkey is so close to the chicken that your little dog has a sensitivity to it. What else? What else could we use? Well, again, once again, if it's difficult to find, okay. Well, number one, you need some patties with the ground up bone, okay? And then you get something just like a lamb shank that little Chihuahua can have fun playing with. So they're going to get that eating exercise. They're going to be gnawing at it, and they get the benefits of playing with the bone, and with the patty also ground up with the ground up bone, then they get the nutritional benefits from the bone. So that's the way I would attack that situation, because it can be difficult to find bones, but just a lamb shank, any other bone that is about that size, root tail, what else? Just have a look around. You know what is available in your area. And sometimes there are bones and things that I have never actually thought of, that people have available to them, or is not available in my area. But something just to match the size of your little dog that they can play with, but to make sure they get the nutritional benefit, actually include some raw meaty bones ground up in a barf patty. All right, next question. Are there any raw meats that should not be fed to our dogs? Is raw pork okay? Well, yeah, anything, any raw meat. I mean, if I can't think of any raw meat that shouldn't be fed, unless your dog had a true allergy to the protein in that meat. Otherwise, and raw pork is absolutely brilliant. In fact, when I have dogs with genuine allergies and they actually don't get better when they're fed, say, chicken or beef or lamb or roux, I will switch them to a pork only diet for a while and see if that is the sort of raw meaty bone and the raw protein that they can tolerate. And quite often it is, because it's, for many dogs, a novel protein. It's something they haven't come across before. So in those instances, pork is very, very good. Okay, next question. What changes in diet would you recommend for nursing females to ensure quality milk production? Some of our females producing more milk than others. All females have been eating raw since birth. Okay. Quality milk? Well, I think it's more quantity here, isn't it? I think what you're talking about is quantity. If you go to my book, Grow Your Pups with Bones, I talk about now. I've got to think back. I haven't looked at this for a while. In fact, I haven't looked at. Nobody's been asking me questions. I haven't been asked to lecture on this question for a long, long time. Raspberry leaf. That is known to help increase milk production. So that's a wonderful thing to use as a supplement to increase the milk production in our ladies. Now, I'd love to know what breed we have and what exactly you're feeding. It's very important that nursing mums that are dogs get plenty of raw meaty bones, and if that means having ground up patties with lots of raw meaty bones, that's very important. And also increase the organ meats. So this is where you might make sure that there's plenty of raw meaty bones in the patties, but also increase the organ meats. Organ meats up to 20-30% of the mix. And also make sure you are including the essential fatty acids, and make sure there are eggs. And just at this stage, use the egg yolk, because that's going to produce, yes, and we're getting back to the quality of the milk there, good quality milk with choline in it for the brain of those young pups. So that would be my basic recommendations for the overall diet of a nursing mum dog. Plenty of raw meaty bones, and if you have to get them into it by grinding them up, that's fine, and increase the organ meat, and make sure that there's also plenty of omega-3 essential fatty acids. And also, I didn't mention that, so I've just thrown that in there. And also make sure plenty of egg yolks, just increase those, the percentage of those. And also, of course, I think also it would be very beneficial to increase the fermented food in that. So something like sauerkraut or kimchi, if she likes it, put it in. If she doesn't, go to something like Gussie's Gut, a wonderful, which is not available in Australia, I'm sorry, but it is available in the US and Canada. And that's a wonderful addition to make mum's microbiome even healthier. All right, next question. I have a 2-year-old miniature poodle, has irregular morning bilious vomiting. I can't pin to anything. Can you suggest something to help? He is do-it-yourself raw fed with patties and raw chicken wings and necks. Thank you. Okay. This is a very good question as well. That bilious vomiting is usually associated with an empty tummy because our dogs are not fed, or this little dog needs more regular feeding, and possibly you need to feed and I'm assuming when you say early in the morning, that might be 2 a.m. or something like that. And this is very common for dogs who are fed at regular intervals, but there's quite a big space between them. So more food, little and often, and a late night chicken wing or something for that little dog to chew on late into the night, that will help very much to assuage the problem, because when the tummy is empty and the dog is hungry, the little dog is hungry, pours out digestive juices and acid, and that starts to make them bilious. So for that late night, early morning bilious attack, which is irregular, make sure that this little one has something to chew on, a supper late at night, just before you go to bed, and that will help enormously. Okay, next question. Please describe in detail the importance of green lip mussels and deer velvet antlers in supplements that poor Rabo's synopsis stated would be in his presentation. I watched 2 times, but missed it. I could tell you about both of those but not in the detail that you want. Okay, I'm sorry about that, but I only know what I know. Okay, I've probably missed that one as well. So I do apologise for that. Green lip mussels, of course, is brilliant because it contains polyunsaturated fatty acids. Polyunsaturated fatty acids are absolutely essential for brain health, for gut health, for heart health, for the health of every aspect of our dog's body because they drop inflammation. They ensure that our every membrane in the dog's body is absolutely tuned to release the right sort of little hormones called eicosanoids. Okay, so that's absolutely essential. Now, deer antlers, a difficult one for me, and I'm going to have to pass that one up. I'd love to be able to answer your question, but I too am a little bit ignorant on that one. This has not ever been part of my raw feeding program, unfortunately, and this is a very specific, mostly New Zealand situation. So I do apologise. That one I cannot specifically answer for you. Okay, next question. 15.5-year-old, 42 pounds female. Oh, I'll come back to that. I also want to add that if deer antlers were something that our dogs should have all the time, they would have been available over evolutionary time to all our dogs. Now, they probably work very specifically, and I'm just thinking about this in a very specific situation. So I wouldn't get hung up on them, okay, as supplements. I've never fed them, and our dogs have been brilliantly healthy and had very long lives. So I'm sure that Paul Raybould had a brilliant suggestion for that. Sorry that I missed it, but I wouldn't get hung up on it. I would get hung up on making sure my dogs get plenty of omega-3 essential fatty acids, however. All right, back to 15.5-year-old, 42-pound female on raw. If I gently warm up store pre-made raw for easier digestion, could it trigger pancreatitis? Since they should not have heated fats like turkey dinner scraps, obviously, we don't feed that kind of food. Thanks. It depends how you warm it up. I mean, if you put it in the oven and take it up to 80 or 90 degrees and then let it cool a bit and then feed it to your dog, you've cooked it. However, I'll tell you what I do with frozen foods to bring it to room temperature. If we have a patty, and it's one that we made, it will be sitting in a Ziploc plastic bag, which we reuse. Now, what I do is I take that out, if I've forgotten to take it out the night before, and I put it in a bowl full of warm water at room temperature. And I'll let it sit there for half an hour or so. And of course, that thaws it out and brings it up to that temperature we want, which is the temperature. And you can keep adding a little bit more warm water because the patty itself will cool that off. So that's a wonderful way to thaw out very quickly without doing anything terrible to the food. All you're doing is bringing it up to room temperature, thawing it out, and doing it very quickly and in a biologically appropriate way, if I can put it that way. It's not destroying any of the enzymes or any of the goodness in the food. It is simply bringing it up to room temperature and a little bit beyond to something like the temperature that an animal would eat a prey animal when they first kill that prey animal. So that's absolutely fine. No problems at all. So that would be my suggestion for doing that. And you're not going to harm any of that food. All right, next question. Low end of normal range of cobalamin. Okay. German Shepherd dog, previously fed vet-approved kibbles, cans, including high pressure and, I'm not sure what HP, and no, GI, I presume. Okay, fed some prescription diet. Blood work done prior to starting commercial raw diet, turkey and vegetable. Can I suggest you just feed real food? if you want to check that again, I don't know whether this German Shepherd dog has any symptoms of a deficiency of B12 or cobalamin or anything for that matter. I do know that he or she wasn't going to do well on processed pet food. Low end of normal range, well, this was prior to feeding raw. I would be feeding raw for 2 or 3 months if you are concerned. And you say it's low end of normal, so it's still within the normal range. But I think this is a good question in terms of should we be worried about these blood tests if there are no symptoms? This is one of the things that really ties people up. Doing blood tests of dogs with no apparent clinical problems, particularly on processed pet food, and then wondering with questions like this. Look, my answer to that is leave your dog on the properly formulated raw food diet over the next 3 months, then repeat the blood tests. I have a feeling they'll be pretty well in the mid-normal range, maybe even to the higher end of it. That would be my suggestion. It really is that simple, because several things here. We don't actually know, even though the blood may show abnormalities for this dog in terms of the average cobalamin levels across a whole range of dogs, it may actually be quite normal for this dog. That's important to realize. Also, the other thing is, once you feed the real food, if there was a problem, the joy of this is that most problems disappear, because it's a bit like, oh, I've now putting the right spare parts in my car, it's working better. Now we're now putting the right spare parts in our dog, and you'll find they work better. And the other thing is getting concerned about individual nutrients within a test when there's no, and I'm assuming there are no symptoms, it's just that this has come up on a test. It's really of no value. This is just one little photograph. Let's look at a series, and my suggestion is that series. So I'm giving this to everybody, because this being hung up on individual nutrients in blood tests when there are no signs, and I presume there are no signs, or if they're related to something, let's get the dog on real food and then see what happens. That's really the most important way to go. So stop worrying, start feeding real food, and watch the benefits, because in my experience, most problems just quietly disappear. If there is a problem, and that's the other issue, we don't know whether this is a problem or not, or I don't know, because I don't know the full story about this. Watch the problems disappear when you feed real food. Let me repeat that again. When you feed real food, the vast majority of problems, and if there are problems, quietly disappear. All right. So, and nutrients are stored for long periods of time in the body. So, again, with real food, those nutrients, they may not show up as very high on a blood test, but they will be stored throughout the body when that dog is on real food. So stop worrying and start feeding real food. That is my most important suggestion. So this is a very important question, because this is an area where so many people get tied up and worry. And worry is a useless thing, particularly when you're feeding real food, because the worry actually disappears, or the need to worry. All right, next question. Hi, doctor. My dog has stage 3 lymphoma. Oh dear, I really am sad to hear that. What is a normal reaction that we should be expecting from feeding him raw? We tried it, but we're scared of bacteria that might just aid the cancer. Well, make sure you feed human-grade food that's been fed properly. Sorry, that's been handled properly. Well, I think I could also say fed properly too. That is to say, if it was beef, for example, that was raised on pasture. People are really worried about this. Now, what I have done with my lymphoma cases over the years, and almost all of them, actually, all of them would have been raised on processed dog food that was cooked to death and ideally would not have had bacteria present. But of course, it did, because once you open that bag of kibble, it's instantly exposed to the bacteria in the air. It's important to understand that. So it's actually full of bacteria too. And also, when they're packing it, no matter how much they cooked it in the room where this stuff is produced, those factories are actually full of bacteria. So this food is already bacteria laden. The stuff that you're thinking is all pristine and clean, it certainly isn't. And a lot of those will be pathogenic type bacteria, whereas the bacteria in raw whole foods is the sort of bacteria that's part of the microbiome that this animal has, or the ancestors of our dogs have been eating for millions of years. So it actually feeds the gut with the right sort of bacteria. This is important to understand. This need to destroy the bacteria in food, firstly, it's hopeless because we can't. Well, we can, but the dogs are going to get bacteria from so many sources anyway. And if you're feeding kibble, it's full of bacteria. So that's one thing. But our dogs actually need the bacteria in those raw foods, and destroying them with high pressure pasteurization or whatever in an attempt to get rid of them, which is what the FDA or other authorities require, is actually totally against the health of our dogs. And your hands are covered in bacteria. Your dog's coat is covered in bacteria. Dogs lick their backsides. They lick other dogs' backsides. Many dogs drink out of toilet bowls. Whatever they come across is covered in bacteria. This seems to be missing from the minds of everybody. But the bacteria on raw food are the type of bacteria that feed the microbiome if they've been handled properly. Okay. And of course, dogs will eat feces. They're coprophagic. They will eat buried bones full of bacteria. What I've done with my lymphoma dogs is switch them straight to raw food. Well-sourced raw food, handled properly, always kept at a low temperature before thawing out, or frozen actually, and then thawed out, and then fed to the dogs at an appropriate temperature in a way that I described earlier, heating them up without overheating them. So we didn't kill the bacteria, never did. And our lymphoma dogs over the years have done absolutely brilliantly when we got them early enough, and often switched them to, or more lately have been switching them to, a ketogenic diet. Now, ketogenic diet is rich in fat, it's lower in protein, and very extremely low in carbohydrate. And this is very important for these dogs with lymphoma. But sometimes we found that some of them did better on a high vegetable diet. But this is a whole other discussion. But the thing is, we did not try to eliminate bacteria from the food because it's important. It becomes part of their microbiome. It's what their body expects. And they were not immune compromised because the real food now supports their immune system in a way that kibble never, ever could. Okay? So this is important. It's important for you to understand that this fear of bacteria, even my autoimmune dogs, the dogs that have a problem or they're apparently immune deficient dogs, we haven't always used, when I was handling these patients over the years, we used raw food. It hadn't been pasteurized, it hadn't been cooked, but it immediately started to improve the immune system. And the other thing to remember is the immune system is there not to fight bacteria, but to help us live in harmony with our bacteria friends in the environment. They're all our friends. They're not our enemies. One or two, if they rise up in large numbers, and I'm talking things like Salmonella, E. coli, Campylobacter, that sort of thing, can become our enemies, but the immune system is there to employ bacteria and to make sure other bacteria are present in larger numbers and everybody is kept in check. And this is the way it works. And in fact, you have to understand that the presence of a little bit of salmonella, a little bit of E. coli, Campylobacter, which is normally present, for example, in chicken, normally present. And we've been feeding this chicken for all my adult life to dogs. And I'm not exactly young anymore. And what this is doing is it's telling the immune system, oh, yes, salmonella's there, Campylobacter's there. I remember you. It's a memory thing. The immune system has a memory, and the microbiome, therefore, has a memory. And it's there to tell us, or to tell our immune system or our dog's immune system, don't forget me, I'm here, keep me in check. But that's why I'm here, okay? So that's my answer. Don't be afraid. You have to trust the fact that our dogs are designed by evolution to eat this sort of food, and it is what keeps them healthy, makes them healthy. And if you're doing a ketogenic diet, then as one of our speakers spoke about, the importance of ketones do not feed cancer, they feed the body. All right, next question. Does butter have a place in a dog's diet? I use it all the time. I use grass-fed butter. Wonderful stuff. It's particularly if you've got a dog on a ketogenic diet. And even a treat where you can freeze butter with peanut butter. And I know as a treat, that is one of the greatest treats you can give. But again, for a dog on a ketogenic diet, because it's high in fat and lower in protein. Of course, the peanuts, hopefully you will have used the raw peanuts to make the peanut butter. But if you don't get too concerned. There are times when we have to go a little bit outside the square just to make a treat. But look, and I use those, even for myself as a treat on a sort of more ketogenic type of diet. But for dogs, I use butter all the time. And particularly if I'm not using it in large amounts for your average dog, but dogs love butter. And I mean, if you could get organic butter that is from non-pasteurized milk, that's absolutely a beautiful, healthy product for your dog. But even if you can't, just good quality butter, particularly from pasture-fed cows, is a great way if you want to get a pill that you have to get into your dog. If you're having to treat your dog with a pill, then the butter is a great way to get it in. So dogs love butter. In my experience, I actually have never met a dog that doesn't love it. And so it's a good, healthy fat for our dogs, in my opinion. All right, next question. How much organ meat should I introduce to my Staffy, 11 years old, and his daughter, aged 5 years, and how regular? Please, and thank you. Okay. Now remember, it's the overall diet that's important. I mean, one day you might feed 50% liver and the rest all meat, but no bones, if that's all you had. But overall, and it's the overall diet that's important. So I'm going to tell you 60, 15, 15, 10. 60% raw meaty bones, 15% raw, low GI, that's glycemic index vegetables, raw and totally crushed, 15% organ meat, and then 10% what I call poo substitutes. And this is the approximate balance of the foods that should be fed to a dog over its lifetime, or over weeks to months, if you like. So that's 60% raw meat. That's just out, and that's the center of a range. So that 60% could be 40 to 80 over time. Sometimes some younger dogs you might feed for a few, at certain periods of growth, you might feed 80% raw meaty bones, or not even certain periods. You might just simply, because that's all you've got. It might be 100% for a few days for a young puppy. That's absolutely fine. But overall, around about 60% raw meaty bones. 15% overall low glycemic index raw crushed vegetable material, usually the above ground type, the highly coloured leafy vegetables, but some carrots, and also a little bit of fruit in that 15%, and 10% poo substitutes to make up for dogs' lovely lovely habit of eating their own poo, the poo of other animals, feces. They're coprophagic, from which they derive nutrients, but we don't feed them that. And keeping in mind that feces is a rich source of fatty acids and protein and B vitamins, then we look at the foods that will substitute for those. So we might throw in some fish for the essential fatty acids, the omega-3s. We might throw in, if we have an athlete, some branched chain amino acids to make up for, and these are very good at healing damaged muscles after a very strongly exercising dog, things like that. But getting back to your question, around about 15% in the diet of organ meat, and at a minimum, liver, kidney, and heart. I like to see for that, because they're easily available. And in that 15%, I would put twice as much. Well, the liver should equal the amount of kidney and heart combined. If you think about the kidneys and the heart, there's going to be a little bit more heart than kidneys, and the liver is equal to that amount. Again, we're not measuring amounts. We've got in our mind percentages, approximate balance. So that's the approximate balance, and that's all you need. When the dog's body is working with real food, and this is the importance, we are feeding food. If you're feeding evolutionary food in approximate balance, and that's that 60, 15, 15, 10 ratio, by the way, not 80, 10, 10, that's just wrong. If you're feeding in that 60, 15, 15, 10 ratio, then you'll be feeding the approximate evolutionary balance, because our dogs are scavengers, and as scavengers, they ate more bone, say, than the cats. They would go in and feast on bones, which other animals might leave, because as scavengers, things like hyenas, vultures, all of those animals are scavengers. And as scavengers, they also ate food that was fermenting and undergoing autolysis, self-destruction by its own enzymes. And of course, that was spoken about by one of our wonderful speakers. So that is the way we look at it. We're not trying to feed, well, the question was about how much liver. So that's a good question. It was a good question because that's a food, and it's part of the overall evolutionary balance, 60, 15, 15, 10. So I'll go through that again. That 15% internal organs, and the bulk of it should be liver, kidney, and heart. They're the main ones, but you can add all the rest in, whether it's spleen, pancreas, even a little bit of thyroid from the trachea, if that's available. Don't go overboard with anything. Just a healthy, wide variety balance. But if you feed those three, in my experience, liver, kidney, and heart, you're going to do absolutely brilliantly. And again, heart and kidney combined is about equal to liver of that 15%. And again, think of it as your handfuls. This much raw meaty bones, this much internal organs, similar amount of vegetable material, and less of the fermented materials, and so on. That's the way you think of it. Think of it. You do that, and the body takes, because the body is designed to work with varying amounts of these foods in this approximate balance. It takes out the nutrients it requires. It also stores the nutrients. Now, that's why the body doesn't need those nutrients, the same nutrients every day, because it stores them. And in fact, by feeding food that is not balanced, necessarily complete and balanced every day, you're giving certain parts of the body a rest. It doesn't have to deal with those things. So just to keep that in mind, think how the dogs evolved in an evolutionary sense. But look, I know I've got off the track, but these questions are very important because they lead down all sorts of rabbit holes. But to the simplicity of feeding raw, where you're not weighing things and using computer spreadsheets to work out how much of each nutrient, simply by feeding that approximate balance of what dogs evolved to eat of real foods, the body does the rest. It's called homeostasis. And this is a dance that's been performed between food and the dog's body. It's been perfected by evolution over millions of years. This dance between the body, the homeostatic mechanisms of physiology, the metabolism of the dog, and the real food presented in its raw state. This is a dance perfected, where the dog takes what nutrients it requires, leaves the rest, stores some, and it's a brilliantly perfect system. And that's why I've always said nutrition, it's absurdly simple. We don't have to measure it. Well, we don't have to exactly measure. We just have to know approximately that balance, 60, 15, 15, 10. Raw meaty bones, low glycemic index, totally crushed vegetables, internal organs, and what I call poo substitutes. All right, next question. 15-year-old with gum disease, tooth infection. I don't have the funds for dental work. Oil of oregano helps, but will bones get the plaque under the gums? Can anything else get under the gums? Well, not really. It's good if you can, but once you start feeding this dog properly, the oral microbiome is going to change. And also, if this dog, I'm assuming if there's an infection, you are going to be able to afford to treat it or have it treated with antibiotics. Now, whether they do the entire job, I don't know. And whether you want to see, antibiotics are a two-edged sword. They only deal with the infection at the time. If you don't change the conditions, then the infection comes back, particularly in the mouth. So, and if teeth are actually loose, well, they will either come out when the dog chews bones, or they may need to be taken out to stop the pain that allows your dog to actually chew on the bones, or to ingest, if there are no teeth left, to just simply eat a patty with crushed up raw bone. But the thing is this, if you can't afford dental work, get your dog started on real food. And if the dog can't actually chew a bone, then make sure you have patties with lots of bone in them, because the kibble was feeding the wrong sort of microbiome, the ones that were causing the infection in the mouth. Start feeding real food, you're building up the immune system, you're encouraging the dog's own immune system to start beating that bacteria. And also, if your dog then slowly starts to chew on bones, as that hit of, I'm assuming you're going to use antibiotics, a hit of antibiotics knocks those bacteria out, makes the dog comfortable, then with real food and real bones where he or she is chewing on them, now we're starting to work on the gums, and that's all helping to improve the local environment. And that local environment, because they're being fed real food, which is boosting the immune system, you're going to rely on that to, over time, help defeat this problem. What you're really going to be doing at this stage is managing it better with real food. So that's the way to go at it. Just quietly start feeding real food. If you have to give a hit of antibiotics because the infection is so bad, don't get concerned about that. Do feed some fermented food, but do remember that if you're feeding real food that hasn't undergone high pressure pasteurization and that sort of thing, then you are feeding food with a microbiome that's going to help your dog's microbiome to normalize, and that's what you want. And of course, there are things like the company I've just joined and been advising, Gussie's Gut, available in America, which is raw fermented vegetable material that has been powdered and is available to help build your dog's healthy microbiome, including the oral microbiome. So let me encourage you to get going with raw food. Again, crushed raw bones if they can't start with whole bones to begin with. But over time, we were going to see an improvement, most definitely. All right, next question. Been told it's not beneficial to add probiotics, prebiotics daily. I rotate between Gussie's Gut and a few others from Adored Beast. How often should I add prebiotics. Been on raw for years. Well, that's a good question, because are there rules? What rules are there? The major rule in biology is that there are no rules. And perfection comes through imperfection. So if you want to add a prebiotic, probiotic, one of these products for 2 or 3 days, then change to another one, or leave 2 or 3 days off, that's a wonderful way to go about it. Or you might do it for a week and then stop for a week, or stop for 2 days. Vary it up, change it. Surprise your dog's internal system, because in reality, that's the way it's been working for millions and millions of years. No rules. Our dogs' bodies, our own bodies, have been designed to deal with surprises of that nature. As long as those surprises include foods, or the types of foods, such as fermented foods, such as the ones you're talking about, just vary it around. Do whatever suits. In fact, for in my own case, quite often, you're busy. Did I remember to pop that on the food today? Oh, I forgot. Doesn't matter. Not important. You see, we started off years ago with probiotics. We took the dairy probiotics, for example, whether it was kefir or yogurt, and we fed that. And actually, the research showed that if these were to be maintained, the bacteria in these foods were to be maintained, you had to feed them daily. Why? Because they really weren't part of the normal probiotic found in dogs. They could become, but they weren't necessarily, unless the dog was being fed those dairy products every day to a large degree. And if you were living on a dairy farm and the dog was eating raw milk every day, they would become exactly that. So that was the research that was done. And so we thought, oh, well, probiotics have to be fed every day. But then more recently we realized, and particularly those of us in the raw food space realized, that none of this was true. None of it was true, because the real food that you feed actually contains the bacteria, as I mentioned earlier. This feeds the microbiome. This is what we want. And you can throw in fermented foods as well. And if the body needs them, it will take them up and use them. But surprise the body with these fermented foods. There's nothing wrong with that. Swap them around. If for some reason you want to feed them every day, you are not going to do any harm whatsoever. All right? And if you leave them out for a few days, you're not going to do any harm, because it's real food. And the body is designed to deal with real food no matter what. But it's, as I mentioned earlier, sometimes this imperfection thing where we don't try and make the same food every day, we vary it around, and we don't look for balance at every meal, is actually more beneficial. It's a bit like we now know that intermittent fasting, where we leave a longer period of day with no food and a short period where there is food, or some days where we don't feed at all, we know this is good for the health of our body. So it is that the switching around of different foods so that each meal is not complete and balanced is also good for the health of the body in a similar way. All right? So I think you have to stop stressing about all these things that worry you, because it doesn't matter when you're feeding real food. Now, yes, if you fed an all-meat diet for 12 months, I think you'd get problems, because that is totally unbalanced over the 12-month period. All right? If you fed a raw meaty bone diet for 4 weeks, that's pretty close to being a balanced diet. And I think I talked about that in the presentations. I may not have, I'm not sure. In fact, if you go to the BARF method of feeding that we're going to talk about at the end of this, I do talk about that. But and so there's a lot to learn to understand, but once you understand the simplicity of all this, and that imperfection actually leads to perfection, as long as you've got that 60, 15, 15, 10 ratio in your mind and you're working on that approximately, you really can't go wrong. All right. So just remember, I mean, these are good questions that all lead to the same answer. As long as you're roughly in the ballpark of the food as prescribed by evolution, the dog is going to do beautifully. All right. Next question. Have a lab. Has had surgery 3 times. Stuff he should not have eaten and got stuck. His system is compromised. Should I feed him twice a day, or can I go back to once a day? You know, I would feed him maybe 3 times a day to start with. Little, and if we have a compromised system, we don't need to put a huge strain on it by feeding a large amount of food. Feed small, little, and often to this dog. That without knowing anything else about this dog. That's my instant reaction to your question. Little and often. Okay? All right. Next question. With the bilious vomiting, would it be best to feed chunks of food rather than mince so it takes longer to digest? And the answer is yes, most definitely. That's why I recommend, if possible, I can't remember what size this dog was. Oh, it was a little dog, I think. So you might just feed a chicken neck that he or she's got to chew on at night, or 2 even. And they can spend most of the night doing that. So yes, whole foods that have to be worked on, raw meaty bones, absolutely brilliant for that sort of thing. All right, next question. What foods optimize the health of my aging staffy who has arthritis in every joint? Well, the whole diet will make such an enormous difference. But the cartilage in young, for example, just in a food I just mentioned, chicken necks, but adding even additions of cartilage supplements, but allowing the dog to chew on the shiny ends of big bones, all that cartilage is going to help the joints. The omega-3s, so raw whole fish. Now, in some parts of America, there are raw fish, particularly salmon, has parasites in it, and other species. So you've got to be careful here. But fish oil as a supplement, most important. So look for white meats and wild meats. And if they're wild, make sure they've been frozen, just in case they do have parasites, which case the freezing is one of the best ways to kill and ensure that. But white and wild, and wild really means an animal that's been fed on pasture, never in a feedlot, and particularly pasture that has got a wide variety of species of plants in it, not just a monoculture of one grass, for example. And so the more you can get the prey animal to be eating the way it was designed to eat by evolution, and then feed that to your dog, the healthier that dog is going to be, because all those phytonutrients, and speaking of phytonutrients, increase the amount of low glycemic index raw crushed vegetables in the diet, because all those phytonutrients are very beneficial for joint health. So increase in cartilage, increase in phytonutrients, and additional supplements of omega-3s, whether it's krill oil, fish oil, and so on. So once you do that and you're feeding the basic diet, things are going to improve. Now, what I have found over the years, that even the most arthritic dogs, you start feeding them take them off. I can't remember now whether you said this dog was raw fed or not. I don't think so. But anyway, but if it was raw fed, then do those extra things I spoke of, increasing the amount of supplements of omega-3 and the vegetable material as described, and the cartilage. But most dogs respond beautifully if they've been on kibble, simply to switching the diet to real food. We see it time and time again. Old dogs are suddenly starting to act like young dogs. Their brain's improving and their whole body is improving, including their joints. But do those additional things, and you are going to see a huge difference. And of course, you throw in herbs like boswellia that are great for joints. And Google that. Have a look at and see what other herbs are going to help joints. Okay. All right. Next question. Oh, turmeric, of course. All right. Next question. Initially, how much raw liver, kidney, heart should you give a lab? Roddy, 15% of the overall diet. Remember, 60, good question, 60, 15, 15, 10. Hard to get it into our heads, I know. Everybody thinks of 80, 10, 10, which is wrong. It's actually, that reminds me to just get you to think about this. This 80, 10, 10, 10 is designed to say, or it's working on the hypothesis that every meal a dog or a cat ever ate was a whole animal, with all the bits derived in that precise proportion. And of course, no dog, and not even a cat, has eaten that way for its entire lifetime. Never, ever. As I said, the dog's a scavenger, eats a lot more bones than that would allow, for example. But no meal has ever been complete and balanced in that way. And so just the answer is 60, 15, 15, 10. That's the answer. Keep those proportions in your mind. Approximate, they're the center of a range. Remember that. If you keep those approximate proportions, you can't go wrong. All right, how are we going for time? We're getting close. Last question. Where do I find recommended measures for ingredients such as turmeric, kefir, chlorella, sardines, ground flax, hemp, mushroom powder, etc.? Is there a guide for amounts? I don't know one. No, I don't. However, let me put it this way. If you work out how much you would feed, there will be a guide for humans, all right? There will be a guide for humans, and there is a way to use that guide for humans to work out how much to give your dog. Now, for humans, we work on this as a basically the same amount, say for adults, and that's based on a 70 to 80 kilo human adult. But dose rate for all of these things is actually related to body surface area. If Jindy, if you can remind me to send you a paper that tells how to work out, extrapolating from the human condition or the human dose rate for anything to dogs and related to the size of dogs, because little dogs, because their body surface area is bigger into their weight, require more per kilo than a large dog. So I can send you that table, and anybody that wants it can ask you and they can get it. All right. So just remind me to send it to you, Jindy, and I will send that. So it's an important question. So thank you for asking it. All right. So we have come to the end of our live question and answer session. Sorry I couldn't answer that one about deer velvet. I'm sure if we look it up and we go back to that lecture, both of us, we will find out exactly what that was for. But in the meantime, thank you for Hair Today for sponsoring this program. There is their website. Please go and have a look at them. And if you would like to know more, if you would like to learn more, then you can join the BAF method, raw dog feeding. Go to that link that's on your on your screen now, and you can go to that and you can learn in detail the BAF method of raw feeding. Okay, petsolmist.com/courses/BAF method. All right. So thank you for attending. Thank you for your questions. I do trust this has been a help. I do trust all of you now understand that raw feeding is actually very simple. It just needs you to think of foods in that 60, 15, 15, 10 ratio and go for it, trusting evolution and your dog's body and the relationship between your dog's body and real food. So thank you again, and I will see you again sometime down the track.